The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So excited for today's episode, as I always am. I'm so lucky to have so many amazing guests come on the program. Today is no different from that. So let me just go ahead and get the announcement done, get the introduction done. Melinda Hereford, say hello to everyone.
Hello, nice to be here on the Dental Brief. Patrick, nice to see you.
Yeah, it's great to see you too. Here we are. It's the first week in April. There's nothing going on in the news. I know you're in California. We're here in Colorado where it's snowing. Tomorrow's opening day for baseball. So there's a lot of fun stuff going on. Today's going to be a great episode. Melinda, I want you to start where we have everyone start. Tell me how you got involved in dentistry. How'd you start working with dentists?
Yeah, my eighth grade counselor going into high school recommended that I be a dental hygienist. So that was a long time ago. And so
Sure.
it was a road. So I did all the prereqs and was ready to apply and worked for a perio office, Patrick. And I really had a change in my dental course right then because I worked one day with the hygienist and I just knew that for my personality and my like kind of what my skill sets are, that hygiene wasn't going to be a great fit for me. I have a little ADD, so I like to focus on different things at different times. And, so the management, so one thing led to another. I worked for some companies and went to work. I sold computers and then I worked for a management company. And that was when I was 22. So I've been at the management piece for a very long time.
That's fantastic. So, website, by the way, let me put it out there right now, is practicemanagementconsulting.com. You can go there. I know we have an offer. We'll get to something that you're going to give to our guests, which I appreciate, a gift for them. So let's just jump right into the meat of the episode here, the heart of the episode. Tell me, what are some problems that you see that dentists are facing? What are they calling you about? What are they contacting you about today?
Yeah, that's a great question. And I'd love to hear from you too, because you're interviewing people all the time. So I'd love for us to collaborate about that. One of the complaints that I get is I'd like to be more efficient. I feel that, so this is from the dentist, the owners. I'd like to be more efficient. I feel like we're repeating steps, which really annoys the dentist, and that, the team could flow better. So that is a common complaint. I mean, everybody wants to make more income in less time, right, Patrick? I mean,
Sure.
we all want that. So that's one of those givens. And then I think the other one that I hear a lot is we want our team to get along, like each other, and
Sure.
have some team flow.
Yeah, that's a lot to unbox. I want to start with, you mentioned efficiency. I want to talk about that for a little bit because I think there's a big difference between efficiency and effectiveness. You can do things really, really efficiently that are not effective at all. Do you see people kind of get caught up in that issue and they're being efficient, but they're not being effective?
Well, actually, I think it really is both for dentists. Like,
Yeah.
I go through different periods where I do on-sites. Our team does on-sites. And so, of course, that's like bringing someone into your kitchen. It's a little vulnerable, but
Yeah.
it is amazing what you see, the things that people say and the things that we do that I think are really unconscious. So I think that there are a lot of in a day, a lot of missing instruments, a lot of missing setups. I think there are some missteps with patients, like the patients don't get the treatment doesn't get passed off. I think there are a lot of those places where they could be more effective and more efficient. So I see both of those being at play. So dentists really like to be efficient, but I think getting a whole team aligned around efficiency is a project.
So Where do you start? That is a big project. Where do you
Yeah.
start? Like,
Yeah.
where do you start munching on that elephant?
Yeah, we do something called a revenue reveal, but really it's like an exam. It's like an FMX for a practice, right? A scan for a practice. And we look at treatment planning, scheduling, collections, retention, and then the flow of the day. And so all of that has KPIs or key performance indicators. We look at those
Sure.
key performance indicators to see how is that all coming out, and are they efficient? Are they retaining patients? And are they growing? And so those are the pieces that we look at. And then based on what the doctor wants, then we're going to dive into that particular system. So you and I visited before about SOPs, and SOPs are kind of like snore SOPs.
Yep.
Everybody knows that they need them, but they hate to make them. And so we've really whittled away at the million steps that a practice needs to take daily to be effective. And we've gotten it down to 6 systems. And so we really focus in on what those 6 systems are so that they can, it's like the 80-20 rule, the 20% that they do regularly, the steps, 20% makes up for 80% of their result. And so
Sure.
we've whittled away to go, what are those 20%? And how do we get a team doing that effectively? So imagine with one patient, there's probably at least 100 steps, Patrick. And so now imagine it's 20 instead of 80.
Right.
Theoretically, you can
Yeah.
see immediately there's efficiencies, right?
Right.
Immediately. And it's pointed towards, we measure those pieces so that then they can also say, we know we're efficient because really reduce some of these steps, but are we effective? And then that shows up in their results. Does that make
Yeah,
sense?
it does. Yeah. Maybe this was you. First of all, back to SOPs, standard SOPs, SOPs, standard operating procedures. I think some people call them standard operating policies. I think there might be another word out there, but it's all the same thing, right? How you do things, especially things that are repetitive. I love to think about SOPs in a way that if you build out your SOPs or your SOPs in a way that would allow you to train somebody without being there, to me, that is a really great way. There's a lot of different tools that you can use that. But it might have been you, if not, it was somebody else that recommended a book to me maybe 6 months or a year ago, a year and a half ago, that I think it was called the Checklist Manifesto, if I remember correctly. That was written by a physician about checklists that are used in ORs across the country and how they worked and worked and worked and worked in order to minimize steps. That no matter how brilliant you are, whether you're getting someone's oral health in line, whether you're removing a gallbladder or flying a 747, anything that is at that type of level requires having steps. They're so important, right? So that it just becomes like, this is what you do next. This is what you do next. This is what you do next. Because we all get to periods of time where our subconscious is driving. We're on cruise control. I think everybody's had that type of day where they've driven home from work and they don't remember their drive home, right? It happens. And we're like, it's never happened. It absolutely happens. So, Belinda, what's your kind of take on that? Is this what you're talking about when you have SOPs, like just having a checklist where it's like, boom, 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 here's what's next?
So I love the Checklist Manifesto. The other book that's a tried and true book, Patrick, is the E-Myth. And so the E-Myth really highlights McDonald's and how McDonald's actually took their processes and really scaled them back, right? So, and made them absolutely repeatable. So it's exactly what you're talking about. Now, most clinicians and owners, they're doing dentistry most of the time, so they don't take the time to do this. And so I would say, having a person on your team that's what we call the integrator or the implementer, the office manager, someone who's very good at executing, to come in and actually start those checklists. And SOPs are awesome. And often they get written and get filed away. And so that's not what we're talking about. We're really talking about functional checklists that you can hire with, correct? And so so that really is what we've spent the last even 5 years doing on our team is like really kind of hacking and whacking about what gets done so that it's easily trained and easily
Yep.
duplicated. And so, I think this is, and it really is, you don't have to wait for the perfect moment. You could just start on check-in, or you can start on checkout,
Yep.
or you could start on treatment planning. We have probably 5 or 7 processes that we do that are critical in dentistry. So for your doctors that are listening, or your leaders that are listening, it's like, don't wait, just start. Because the truth is, when you start, then you will get things that are placed. I have a client right now, Patrick, that has 5 offices, 50 people, and 3 of those offices are de novo, and 1 homegrown leader and 2 or 3 new leaders. So you can already imagine, right? You kind of can imagine how messy this gets, because that homegrown leader can't actually train everybody. So we're kind of going back to square one and making those fundamental checklists so that those 50 people can be onboarded and then trained and developed, right? And so it's like, no matter where you are, there is always a place to start. And what I would say is that refining to that 20% so that people know, okay, I'm nailing it or I'm not, and then they can self-correct.
Right. Yep. Makes total sense. Writing SOPs, SOPs is not my strong suit whatsoever. And I know a lot of people, it is just not. And this might be something that you try to do yourself, and it is very overwhelming. You get very frustrated. You don't know where to start. There's so many SOPs. By the way, I think a good one to start with is like your onboarding, your new team members. That's a pretty good SOP to have, or an SOP on how to write SOPs. Right. Here's how we're going to produce our SOPs. But here's what I'm getting at. If you're one of those people that are like me, that absolutely, that thought of putting these together is overwhelming and frustrating, get help. Right? Even if it's not, get some help with this, because a lot of people have these SOPs already ready to go that can just be quickly customized to you, or they have a great deal of experience working with them. So they know what you need next, what is missing. Like, oh, did you forget this? Did you forget this? Did you forget this? Be really, really helpful. And so this is a really good time for us to talk about gift. I know that you had mentioned something like, hey, can we do a gift for your listeners? I said, absolutely, of course. What does that look like?
Yeah, so we have a gift. One of the tools that we use is, the system is Get Paid First, Patrick. And so this system actually, when placed, unburdens 5 other processes in the practice. So it really lightens the load from a lot of other perspectives and increases retention and increases patient acceptance. And the Get Paid First is really our process for making sure that every office gets paid when they do the service, so that we're not waiting around for, oh, the insurance didn't pay everything that they were supposed to pay. So our goal is no accounts receivable. 0 accounts receivable. And so this system actually helps them get to no receivable, basically. So we'd love to gift that to them. We'll include a QR code in the show notes for you and for your listeners so that they can implement that system. I love this system, Patrick, because when we're freed up from AR, we can actually focus on patients who need treatment, right? And calling those patients. Right. So it really frees us up to do what we do best, which is actually take care of patients.
Yeah, that's awesome. So we appreciate that offer. Check it out on our site, the Dental Brief. Check it out on social media. Reach out to Melinda at practicemanagementconsulting.com. Melinda, thanks for coming back in. Before you go, I do want to mention, I want you to come back on the program sometime in this next quarter. And let's jump into the teams. You talked about making sure your team gets along, or wanting them to get along. I think you're going somewhere with that, by the way. And let's have that conversation here soon. So look for another episode from Melinda coming soon. Melinda, thank you.
You're welcome. Thank you, Patrick.